hello, how do I get my daughter to pull up the back of her pants? She only pulls up the front. She has weak fine motor and is also unaware that they are not pulled up. They get blocked by her diaper. My OT said to sew something into her pants as a target, something she can grab. She's 5, and thanks.
Yeah, that's a very common issue, and your OT is very smart. That's a really good idea. And yeah, so this is typical to all kids, by the way, that, you know, they don't realize that something's in the back and they're supposed to do that. So I think it's a good idea. If you could just, you know, often we forget that we need to divide things into sub-behaviors. Like we think that everything is one long behavior. It's not.
Yes.
It's chains of smaller behaviors. And, you know, the only behavior that you're really trying to focus is for her to get that, touch that sewn in tag or whatever that you do end up sewing there. So if you could just stand in front of her when she is doing that, and after she pulls the front, then just direct her hand towards the back. So she touches that. Initially, you'll have to teach her when she touches it to pull it up. Then gradually it'll just be a tap from you so that she remembers to touch the back of her pants, and then the tag will be there and it'll prompt her to do it. And then gradually you can reduce the size of the tag, and then gradually she'll just do it. And hopefully by then you don't need a diaper anymore.
Yeah, right.
But this is a very common thing, and it's just a matter of focusing on that specific section of the chain of behaviors.
I think it's so fascinating how everything in your life prepares you for everything in your life.
Yeah.
And when I was first in college, my dad had a stroke, and he lost a part of his brain so he had speech aphasia and had to go through speech therapy, and we had to work through him gaining back speech, which
Amazing.
You know it seemed like a horrible thing at the time, but it prepared me for so much with my son. And then when I first moved to California, my first roommate was someone who was studying OT to be an OT, and she would come home on a nightly basis and have to write task analyses. So there were 3 girls living in this apartment, and she would say, I just need you for the next hour to walk to the refrigerator and open the refrigerator 100 times while I sit and notice every fine little thing that you do. And then it might be brushing our teeth, and she would write down all of the different steps. Otherwise, it would never have occurred to me how many steps there are to something, and how many different ways that a person can get off track, and how important it is to tear it apart into those little bits to find where it's falling apart, fix that little piece. That's so right. That the whole string of behavior can suddenly work.
That's so true.
So then my child got diagnosed with autism, and all of these things previous in my life came back, and
familiar.
I went, okay,
right.
I can do that. But for anybody who didn't have that experience,
right.
It's so empowering when you realize all those little itty-bitty behaviors, like those of you who've written in and said your child is having a hard time learning how to ride a bike. Oh my goodness, there's so many behaviors, little behaviors that have to be perfected in order for somebody to be able to pedal and get down the street. We take these things for granted.
No, we do. I know, we absolutely do. And if you think about it, every single thing is a series of behaviors, right? It's a chain of behaviors, and it's great that you pointed the task analysis portion out. I mean, that is what ABA is all about, right? It's all about taking a chain of behaviors and breaking it into the smallest targets, and then teaching those targets, and then kind of putting them all together. And in fact, Shannon, we, as you know, skills and our whole curriculum is listed in series of the smallest possible targets. So if you want to teach one thing, you have 1,000 steps to it. But as we developed CARD for adults, which now exists and is growing pretty rapidly, actually, we wrote it all in the form of task analyses. So we wrote the largest kind of the goal, and then we just wrote the task analysis of the individual portions to that goal, whatever we're teaching our adults. So it's very much the same thing.
And it's wonderful because you don't have to do what my roommate did, which is say, walk to your husband, walk to the refrigerator 100 times so I can write down all the things. It's there for you in skills. Yeah. I love that.
And we don't realize how tiny the chains can be. For our kids, it's very hard for them, because it's hard for them to, learn something that involves all of their senses. Often they're sensory dysregulated in some way or another. And of course, a number of different motor movements and paying attention to multiple cues and all of that is very hard for our kids.
I always tell the story of when I was doing IBT and realizing they were talking about task analysis and chaining, and the example they gave was a child learning how to put their own shirt on and taking the shirt, laying it out on the bed, and then taking and scrunching it up from the bottom to the neck before putting it over their head. And I was telling a friend, I never would have thought of that step. That's the step. And she said, wait a second, I got to get it. She has a neurotypical daughter. She said, I got to get a pen. I got to write that down. That's what I've been doing wrong, that I couldn't figure out why she wasn't getting it because I forgot that step too. So just keep in mind, even if your child isn't on the spectrum, children, if they don't learn a certain step, can be unsuccessful. And that's not rewarding when you're unsuccessful at something. So skills can help you to be successful at all of these things. We got a little off track, but I think it's all worthwhile. Okay, next question here. Hi, thank you for your much needed show. My 5-year-old doesn't answer questions consistently at home or at school. He's about 50% for answering, even though he can understand the questions. How do I help him respond more? At times he will ask for something instead of answering, so I will make him answer before I will give it to him. What other activities can I do with him to get him to answer?
Right. So I think and we don't know much about the questions and we don't know anything about the child, but I think generally you start with 2 types of questions that are easy and questions that are short, where the answer is short and the question is short. So when I say like short, you would say things like, what color? That would be a very easy. What color? And that's a good one because it'll have a visual, right? It'll have a visual prompt. So that makes it something that we know is easy. And both your question is short and his answer is short. Those are very important. Now, if you ask something that's lengthy, obviously the child's going to probably get lost in the question, not even know what you're responding to. Or asking and just not even know how to respond. So as long as you can keep the question short, and pick something that his answer is short or her answer is short, and as long as it's easy for the child, so it's something he's already mastered, that's where you start, and then you gradually shape one or the other. So you either make it slightly harder or you make it slightly longer. My suggestion would be to make it slightly longer.
Okay.
And then that's how you make a child answer any question.
Okay.
And also, keep in mind, a lot of children have visual strengths. Auditory is a much harder skill because auditory is momentary, so once you said something, it's gone. With visual, it stays in front of you. So a lot of times it helps if the child has a visual cue of some type, whether they can read and you can write the question down, or a picture that can prompt them in some way helps a lot too.
Okay. And then obviously making sure that when they do respond and answer the question, that we reinforce them with something that's meaningful to them.
Absolutely. And obviously also making sure that they're attending when you ask the question.
Yes. Oh, hard. Okay, so another person writes in and says, I've been trying to get my 4-year-old son to talk more, but he echoes everything I say. Example, I get him to say, I can't get him to say mommy because he repeats and says, hi, his name. What can I do?
Right. So that's a very common thing, and it's a good thing. Don't let it bother you or scare you. Echolalia is a good thing because that means the child has started to learn, like typically developing kids where they hear something and they echo it. That's one of the early phases of development, so that's good. It's a little late at 4, but that means that he's going to develop speech. So right now, first of all, you should be getting a lot of ABA right now. For a child who's echolalic, that's kind of one of the prime subjects for ABA. Is a child is echoing, they are learning, and you need to get them a lot of instruction. But secondly, if you're doing this yourself, obviously, so the concept is that you'll ask a question or you'll say something and you don't want your child to say the same exact thing. You want them to say something slightly different. So you will have to block their response, which means when you say, "Hi, Kyle," they'll say, and they're about to say, the child's about to say, "Hi, Kyle." You'll block the Kyle portion, and then you'll visually prompt the child to say, "Mommy." So you'll say, "Hi, Kyle." And then you'll block and say, "Hi, Mommy," and then he'll imitate, "Hi, Mommy." And then you gradually will remove your prompt, which is blocking him from repeating you, and he'll gradually start. So that's one way to get someone to stop imitating you and start saying what's appropriate. Another prompt is a visual prompt. As I said, you could have written down, "Hi, Mommy." You could have a picture of Mommy, which you will put in front of him right when he's supposed to say, "Hi, Mommy." Those are just some of the ways. Essentially, with any behavior, you'll block the child's incorrect response and prompt the correct response, and that should work.
Okay, we've got a child who's being afraid to go to school. Somebody writes in and says, "My son, 4.8 years old, has been attending an autism school since summer of last year. He's learned a lot, and I like all the therapists he works with. Lately, when I'm dropping him off at school, he'll start saying, 'I don't want to go to school. School is scary. I want to go home. I feel horrible leaving him, but I know he needs his therapy.' I spoke with the behaviorist about it, and she said that nothing has changed. Everything is the same, so she does not know why he's saying this. She said that they're going to start reinforcing him as soon as I'm dropping him off with some sort of praise or small edible just for coming out of the car with no complaining. Also at home, if the lights are off in certain places of the house, he'll say I'm scared even when there's people around him. I don't know if there's any relation, but I just want to add, should I be concerned about him not going to school and saying it's scary or monster? We are in New Jersey. His school is the best around here."
Yeah. This is one of those circumstances where I would try to err on the side of caution rather than not, and I would suggest that you, obviously the problem is that if you ask for an observation, I don't want to scare any parents, first of all. I don't want anybody to be afraid, but the truth is, if it was my child, I would want to know what in school is bothering my child. Now, having said that, the dilemma here, of course, is that our kids tend to be very good at figuring out how to get out of things they don't want to do. Yeah. And that manipulation is always a sign of intelligence, and I love that our kids figure out, if I do something, if I say this is scary, maybe I can get out of school. Yeah. That could be possibly the reason, and that would be the best possible scenario. It could also be that there's actually something happening in school which he's afraid of. Now, I often tell people our kids tantrum, hit, aggress because they can't verbally communicate. You have a child who's verbally communicating, it would be absolutely wrong to ignore his communication. You need to investigate his communication. Otherwise, you're teaching him that verbally communicating does nothing for you. Okay. So you need to investigate and find out. If you find out, we'll talk about ways you can investigate momentarily. Now, if you find out that everything's okay and he's just manipulating the situation, then you will need to start teaching him that manipulation doesn't work, that no, everything is fine, and there's other environments that you can get. You'll just increase reinforcers, perhaps. If you find out that there's something bad happening, of course, that's very, very important, and you'll fix that. Now, how do you find out? Unfortunately, if you say that you're going to observe, things are going to be different on the day you observe. And New Jersey is a pretty strict state, so they might only allow you to observe for 20 minutes at a time, which is not going to be beneficial. As a parent, my suggestion is put a recording device on his backpack or on his shirt or something like that, and I think you have the right to do that. And there's so many things out nowadays, little devices.
You can get them at most stores. I mean, we have one. I think it's a good investment for a parent to get one anyway, the little
Yes.
digital voice recorders, to take to your IEP. So it's an investment, and they have some that are $50 now, and you'll use it forever, and you don't have to buy tapes to go with it because it's digital.
Absolutely.
And they're teeny tiny, and you can stick it in a backpack, stick it in a pocket. We've seen parents do that. We've seen parents do that in New Jersey.
Yeah, absolutely. I mean, you need to know, and so there's also devices that you can actually record. Okay, video. I mean,
Yes.
video record.
Yes.
But I don't know that you need that initially. You might, if you can look online and look for a device that allows you to video and audio record. But generally, if it's video, you're not going to get good audio with it. My recommendation would be to look for audio first. It's easier, and you can just put something on him that will allow you to hear the whole day. And all you're really looking for are signs in his verbal, dialogue, signs of distress. So when does he start to say, no, I don't want to do this, or no, or what happens during the course of the day? And this is very important, I think, that you find out what is actually causing him to be afraid.
I do want to say that the laws are written in such a way that it can be questionable whether you have the right to send a recorder. So you'll want to consult with whatever legal you have the ability to do. I will say that as a parent and as a former teacher, that if someone is so afraid of what you might pick up in the classroom that they would be affronted by you doing that, then not everything is not okay in that classroom.
There's something wrong. Yeah.
It's not like at any point somebody could have walked into any classroom that I've ever been in and taken a look, and there would have been nothing to be concerned about. And anybody who is worried about that, I want to know as a parent and as an educator, why? Why would you be concerned about that?
Absolutely right. Very good point, Shannon. And I would, if you have a hard time with that, or if it gets to that level, another way to approach this is to actually speak with all the parents and ask if they would all agree. I mean, if there's a PTA, or if you can gather some of the parents. If it sounds like it's an autism school, so that means that your classroom potentially doesn't have a lot of children in it, and if you can contact all the families and ask if they would agree. There are video devices that are very small. It's cameras that's this big, and they are audio and video, and they move according to however you want it to move, and you control it through your phone, which I think is spectacular. And they have day and night vision. They're pretty amazing. I have one in my room, and I can actually look on my phone and move the camera in whichever way I want in order to be able to see what's going on and hear it.
Yes.
Which I think is fantastic, and it costs, I think, $90-something.
People
it's
have these
nothing.
to watch their dogs.
But that's what I'm saying. So I think you should do that, and you should definitely ask the other parents, and if they all agree, have the school put one into your classroom.
Yeah, and keep in mind that it's easy enough when a child says that they're afraid of something at school. When you think about the millions of things that it could be that aren't necessarily the worst thing, it could easily be that somebody came out of a bathroom stall and unintentionally startled a child. Like there are so many things that it could be.
It could be outside. Someone is blowing the leaves, and that sound bothers the child.
Yeah.
There's a million things that our kids are disturbed by, but it's important to find out.
Yeah, no matter what it is, it's important to find out. I totally agree. All right, I'm going to squeeze in another question here. So my child will be 5 in June, and he's been fully potty trained for 1.5 years, but still doesn't know how to wipe his bottom. Is it time to teach him? And if yes, how do I start? He's considered high functioning and has decent language, and understanding is good too. In school, they said they can teach him, but I don't know how I feel about it. They've never had to wipe him because he does not take a BM at school. I would rather teach him myself, and we don't have an ABA provider since our self-funded insurance does not cover ABA anymore, but did for a full year, but they said it was a mistake. Anyways, just in case you were going to ask if we had an ABA provider, thank you so much. You are truly angels. This is a parent that has written it to us before that had a full year of ABA, and then the self-funded insurance realized that they didn't have to pay for it. I don't know how people sleep at night knowing that they've taken away something like that.
Yeah, I don't think they realize that they're affecting lives. I think they just feel very proud of themselves because they've saved some budget somewhere.
Right. Which is sad because
It's
they
very
didn't
sad.
save any money. They
Right.
saved no money because they will have to pay so much more for that child for the rest of their lives.
It's unbelievable. So I have two quick answers. One is, of course, like anything else, you do a task analysis and you basically break it into the smallest steps. I don't know how far your child goes already at this point, but I would start with just using wet wipes first of all. Please, that's very, very helpful. Obviously, unfortunately, wet wipes are a little small. Sometimes our kids need 2 or 3, but that's another step. So as Shannon said, try to sit down and list every single step that's involved for you. And for instance, opening the top of the wet wipes, pulling out 2 wet wipes, that would be another step. And then actually wiping, and perhaps you want to make sure that the child does that 3 times or 4 times, followed by pulling out tissue maybe or toilet paper and using that to dry, and each time being aware of if it's still clean or now dirty, or do I still need to do it. Each of those things are one step, and if you can you do the rest, and that one step that you're working on is what your child does. And usually with these types of things, we do what's called backward chaining. So you will do all the steps for your child, or you will help all of the steps, but he does the last one himself, and then you reinforce it. And you do now he's mastered that, and then you do all the steps except the last 2, and he does the last 2, then gradually he does the last 3, and then you basically backward chain so that you're requiring him to do more and more, but you're doing the first stuff and he's doing the last. And that way when he finishes the task, let's put it that way, and he gets reinforced. So that's kind of one way, that's what you need to do, is a task analysis. Now, having said that, I think there might be an actual module of training on IBT, which has to do with you should look at the toilet training module and see if it involves wiping and cleaning. If it doesn't, then I'll probably suggest to the director of IBT to produce one. We are going to be making, this was an idea she actually recently had and we talked about it, we're going to be making a series of videos for IBT, the Institute for Behavioral Training, which are very short segments that do stuff just like this, how to teach things, very short skills that are very necessary skills. Also little things like taking a child out to restaurants. I mean, there's like a million different things, and we want to do steps like showing people how chaining works, showing them how various prompts, every prompt, small segments of video. So yeah,
absolutely love it.
That should be helpful.
Kelby, I'm not sure. Do we have time for another question? Okay. Do you have time for another question?
Sure,
okay.
absolutely.
All right. Hi, and thank you so much for your show. My son was diagnosed when he was almost 3 with Asperger's. I questioned the diagnosis because my son didn't have advanced speech or typical speech. It was delayed. The developmental pediatrician explained because he had single words before 1 and was putting 2 words together before 3. He met the diagnosis criteria. Problem is, his speech at 5 still hasn't taken off. Some days it's better than others, ups and downs. His speech therapist says he tests at low average range and not at the disorder range. So I ask why hasn't his language taken off? My ABA says it's due to his anxiety. How can we help him with this area to minimize his anxiety so he can function socially and with his language? There's a lot here that's confusing to me.
Extremely, me too. and I disagree with pretty much all of your providers, so it's a little concerning to me. So let's go through this one by one.
Yeah.
He was diagnosed when he was almost 3, and they diagnosed him with Asperger's. And when you questioned it, they said that he explained because he had single words before 1 and was putting 2 words together before 3. That's why he got a diagnosis of Asperger's. That makes no sense at all. That has nothing at all to do with the diagnosis of Asperger's. So I don't know what reasoning that, to me, that sounds like someone who wasn't very clear on what Asperger's is. So, it really doesn't have to do with how much language he had at one point. The fact that he had some pretty significant delays in language at 3, to me, indicates that he had more than just an Asperger's, Asperger's, just so you know, and ASD as a whole, Asperger's doesn't have much of a language delay at all. So from my perspective, your child qualified for autism. It sounds like they had an autism diagnosis. And that would also better explain why your child doesn't have language right now. If it was confusing to me is that, well, first of all, his speech therapist says his test at low average range, great. He should actually have, increased to the point where he has average language across the board. And let me just also say that generally speech pathologists will test you for speech and not for language. Advanced language pragmatics, for instance, social language, is measured separately and should be measured. And then you say that your ABA says that his language delay is due to anxiety, which is fascinating that an ABA person would actually have anything to say about anxiety. I commend that. That's great. If your child has anxiety, you definitely need to deal with that issue. So it implies that you also have ABA going on. So, hey, maybe your child has done really well between 3 and 5, in which case he really shouldn't have any delays. And it's not just in language, but across the board. So it's kind of chaotic for me, and I can't really figure this out. I would encourage this family to write back in and give us a little bit more detail. Here's where I stand, just to give my final words of advice, if I'm right, if I'm reading the scenario right. Don't worry too much about the diagnosis. Your child has some delays still. Focus on the delays and work at them pretty intensively. The diagnosis doesn't matter. The fact that he has delays gives you stuff to work on. Work on it, but work on it intensively. If your child is 5 now,
yes.
You please be doing very intensive ABA, which means 40 hours of ABA before it's too late, because your child has to catch up pretty rapidly. So you need to pack his schedule with as much ABA as you possibly can, and you want to make sure that your ABA therapists are all aware of the fact that he has some anxiety issues. Anxiety often comes from being a little bit on the obsessive side and wanting things to be perfect in a certain way, which is one of the key characteristics of autism as well. Let's make sure we're also dealing with that, allowing the child to have as many areas of control as possible, and also maybe even meeting with psychiatrists if your child has anxiety. But keep these issues separate. Do not worry about the diagnosis. In fact, the diagnosis will only get you funding. That's a way to look at it. And let's give your child some intensive help.
Love it.